Hello, everyone. My name is Antoine Martin, and I'm with the Men's Health Equity Institute. Today, I'm going to talk to you about understanding HIV and AIDS. So on June 27th, it's actually National HIV Testing Day. And so because of that, in observance of that day, I'm going to do a presentation that talks about the impact that HIV and AIDS has on men. So without further ado, let's go ahead and get started. And of course, later, probably near the end of the presentation, I'll talk a little bit more about National HIV Testing Day. So on the agenda, these are the things that I'm going to discuss. We're going to talk about basics to HIV and AIDS. We're going to talk about some epidemiology, prevention challenges associated with men. We're going to talk about HIV testing and risk reduction strategies. And we'll also cover linkage to care and advocacy. And like, as I said earlier, we'll talk a little bit more about National HIV Testing Day. So when we cover some of the basics of HIV and AIDS, let's start with the acronyms. HIV, right? The acronym for Human Immunodeficiency Virus. So when you think about that, human is what? That's us. And then immuno is our immune system. So this is the system of our body that protects us from outside agents like germs and bacteria and other things. And then there's deficiency, which is a lack of or shortage of something. And then the virus, which is an infectious agent. So when you put that all together, you basically get an infectious agent that attacks the immune system that tries to deplete the white blood cells in the human body. The HIV virus, it causes HIV infection and can lead to acquired immunodeficiency syndrome, so also known as AIDS. So when we think about AIDS, AIDS can also be referred to as like stage 3 HIV or the last stage of HIV. And basically AIDS is where the immune system becomes so weakened due to the stress of the HIV infection on the body. The HIV infected person may or may not have AIDS. So if detected early and linked to medical care, a person can avoid getting an AIDS diagnosis. And they may or may not have signs or symptoms of illness, but are still infectious to others. So HIV does not always show signs or symptoms. Hence, a person, they can live years with HIV and not know it. The only way to know that you have HIV is to get tested. So remember that. You can live, I'm talking about like anywhere from 8 to 10 years without ever showing a sign or symptom of HIV. And then once you hit that 8 or 10 year mark, you're going to get really sick because the HIV is going to have weakened your immune system to a point to where all those infectious agents outside of the body that we're talking about, like the germs and bacteria, now become a threat to you. Specifically talking about the modes of transmission, you can only get HIV through bodily fluids of an infected person. And so these are a list of the bodily fluids that you should be conscious of. So HIV can be found in blood or menstrual flow, semen and preseminal fluid, also known as precum, rectal fluids and anal mucus, vaginal fluids, breast milk, and cerebral spinal fluid. So HIV, it can be transmitted through unprotected sex, through sharing injecting equipment from mother to baby during pregnancy, birth, and breastfeeding, and through contaminated blood transfusions. HIV, it cannot survive outside of the body. It cannot be spread through the air from touching toilet seats or shared cutlery. So good to know. Epidemiology. In 2018, men made up 81% of new HIV diagnoses in the US. Of these men, we saw decreases in new HIV diagnosis in all other age groups except 25 to 34-year-old men. 25 to 34-year-old men in 2018 were the only group that we saw an increase in new diagnosis. So that's a group that we need to potentially or really pay close attention to and find out, okay, how can we get those new HIV diagnoses lower? How do we get them to decrease? And then this is a diagram here. So when you're looking at new HIV diagnosis among men in the US in 2018, we see that most of these new HIV diagnoses among men were attributed to male-to-male sexual contact, all right? And then followed by that, you have heterosexual contact at 10%, injection drug use at 5%, male-to-male sexual contact and injection drug use at 4%. And then we see other risk categories is less than 1%. So we're seeing different levels of risk by risk category. However, I want us to be mindful that regardless of risk, if you come in contact with the aforementioned bodily fluids that I talked about, blood, semen, vaginal fluids, breast milk of someone who's living with HIV and has a detectable viral load, you can still be exposed to HIV. All right. So although the risk categories here, they illustrate which groups are at higher risk, we should never forget that HIV does not discriminate. So moving on to prevention challenges associated with men. So 1 in 7 men are unaware of their HIV status. People who do not know that they have HIV cannot get the medicine they need to stay healthy and prevent transmitting HIV to their partners. Therefore, they may transmit HIV to others without knowing it. The only way to know if you have HIV is to what? Is to get tested. Prevention challenges associated with men continue. High rates of sexually transmitted infections. In 2018, rates of syphilis and gonorrhea were higher among men compared to women. Having other STDs can greatly increase the likelihood of getting or transmitting HIV. Using condoms the right way every time you have sex can protect people from STDs, including HIV. Now, to go a little bit more in detail about why that is, when you have an STI, sexually transmitted infection, or if you have any other type of infection, think about the immune system becomes active and it goes to fight that infection. Well, if we remember, HIV, it likes to attack the what? The white blood cells, your immune system. So if your immune system is active because it's fighting another infection, that gives HIV an opportunity. If you come in contact with HIV, it gives HIV the opportunity to infect your white blood cells and basically seroconvert you to being HIV positive. Injection drug use. So sharing needles, syringes, and other injection drug equipment, for example, like cookers, puts people at risk for getting or transmitting HIV. In 2018, men accounted for 73% of the 3,864 new HIV diagnoses that were attributed to injection drug use in the US independent areas. So people who exchange sex for money or drugs may be at an increased risk for HIV. And according to a 2018 National HIV Behavior Surveillance Special Report, 23% of men received or gave money or drugs in exchange for sex. Sexual contact. Anal sex is the riskiest type of sex for getting or transmitting HIV. Receptive anal sex is 13 times as risky for getting HIV as insertive anal sex. So men can also get HIV from having vaginal sex with a woman who has HIV because why? Vaginal fluid and blood can carry HIV. So remember what I said earlier when we talked about those bodily fluids, vaginal fluids and blood are on that list. If someone has HIV and they're not on medication, HIV is going to be in those fluids. So using condoms or taking medicine to prevent or treat HIV can decrease the risk. Limited healthcare coverage. Based on 2018 census data, over half of the persons without health insurance were male. Not having health insurance can limit men's ability to accessing HIV testing services and health education. And then stigma. In spite of all we have learned about HIV since it was first discovered over 30 years ago, many people still fear that others will think less of them if they are diagnosed with HIV. They are also aware that they could be discriminated against if others learned of their HIV positive status. However, in the United States, those who are HIV positive are protected from being discriminated under the Americans with Disabilities Act. And then to even go in more detail, each state has their own laws around HIV discrimination and things of that nature. So I always suggest, look up what your laws are in your state to see what the protection measures are for people living with HIV. HIV testing and risk reduction strategies. So learn ways to protect yourself and others. And these can be done in a few different ways. So one, if you limit your exposure to these fluids, you can limit your risk for HIV. So the fluids that we're talking about here are blood, semen, breast milk, vaginal fluids, rectal fluids, and cerebral spinal fluids. So kind of what we talked about later. If you limit your exposure to those fluids, you'll limit your risk for HIV. Additionally, using condoms. If used correctly, condoms can be 99% effective in reducing HIV and other STIs. There's also limiting the number of sexual partners that you have. The less sexual partners you have, the less your risk for HIV. There's talking with your sexual partners about their HIV status. and the last time that you were tested, or if they have an undetectable viral load. It's always good to have that conversation, talk with them to find out, when was the last time you were tested? What is your HIV status? So that you can make a more informed decision about how you move forward. You can also choose what type of sex each of you is comfortable with engaging, such as oral sex, mutual masturbation, etc. So here we're talking about consent. All right. So you should not feel like you have to engage in anything that you're not comfortable with. So always, seek your partner and let your partner know what you're comfortable with doing. And then there's abstinence, deciding not to have sex. There's PrEP and PEP. These are HIV medications that reduce a person's risk for HIV. Of course, these are also people that don't have HIV that are on this medication. And then there's also, of course, there's a plethora of other options. Also looking at deciding not to inject drugs. This is the best way to prevent HIV by not injecting drugs. So you can always talk to a counselor, your doctor, or healthcare provider about treatment for substance use disorder. They even have medication assistant treatment as well, if that's an interest. And then, don't share needles, syringes, or other drug injection equipment. And these are for those individuals who, let's say, they're struggling or still challenged with drug use and still working on their journey to recovery. I will say, don't share needles or syringes or other drug injection equipment. And also, use bleach, and also understand that a disinfected syringe is not as good as a new sterile syringe, but it can greatly reduce your risk for HIV. So the goal here is to reduce your risk for HIV, right? And then know your status. Testing for HIV is the only way, like I said before, for you to be sure that what your HIV status is. So many people, like I said, they don't show symptoms and they can live years without knowing that they have the virus. So getting tested for HIV, it's quick, easy, it's painless, it's confidential, and almost always free. Test for HIV regularly to keep yourself and your partners healthy. If you know your status, you can stop worrying. So because I know some people, like myself, do better with visuals and certain metaphors, I decided to use the help of our friends here at helpstopthevirus.com. And I'm going to show you a short video discussing the importance of HIV testing. So here we go.
HIV is a fact of life. So is HIV prevention. And today, there are lots of ways to help prevent HIV. The first step, knowing your status. And that means getting tested, maybe even retested. Because when you know your status, you can take action to protect your health and the health of others. Already been tested? Well, that might not be enough. You should know that the U.S. Centers for Disease Control and Prevention recommends retesting every 3 to 6 months for people at higher risk for HIV. But figure every 3 months, just to be sure, because that's how long it can take for HIV to show up on a test. You should also know the factors that can put people at higher risk for HIV. For example, men who have sex with men, people with more than one sexual partner, transgender people who have sex with men, people who have recently had a sexually transmitted infection, or those who use injection drugs. Even if these factors don't sound like you, there's another reason to get retested. And that's if you think you were exposed to HIV. If that happens, talk to a healthcare provider as soon as possible. He or she will know the right HIV test to give you. Maybe you already knew all that. And maybe you already know your HIV status. But if you're not sure, or if it's been 3 or more months since your last test, it may be time to get tested or retested. Then you can take steps to protect your health and help prevent the spread of HIV. So get routinely retested. Maybe think of every season as retesting season. If your test results are positive, talk to a healthcare provider about starting HIV treatment. There is no cure for HIV, but starting and staying on treatment can help you live a long and healthy life. And it can lower the chance of passing HIV on through sex, so you can protect the people you care about. If your test results are negative, you can keep things that way. Use condoms, never share needles. Ask a healthcare provider about all the ways to prevent HIV. and get routinely retested. Hey, is that snow? Must be retesting season. When the sun comes back, it's retesting season again. So, if you're at higher risk for HIV, think about getting retested as the seasons change. It's an easy way to stay on top of your status. Plus, it helps protect your health and the people you care about. And when we make every season retesting season, we can help prevent the spread of HIV and help stop the virus.
All right, so hopefully they gave a good summation of what I was talking about earlier about why you should get tested and what the testing process can look like and how often you should get tested, right? All right, so moving on to linkage to care. Linkage to care is a crucial early step in successful HIV treatment and is typically defined as the completion of a first medical clinic visit after HIV diagnosis. Linkage to care plays a key role in the HIV care continuum. It is a necessary precursor to antiretroviral therapy initiation and viral suppression. So evidence clearly demonstrates that antiretroviral treatment significantly reduces the risk of developing HIV-related complications. In addition, antiretroviral therapy dramatically reduces HIV transmissions to others, and without timely entry into care, individuals with HIV miss an opportunity to benefit from HIV treatment at the earliest stage feasible. Rapid initiation of antiretroviral therapy after HIV diagnosis is a key pillar of the national initiative Ending the HIV Epidemic, a Plan for America. Undetectable equals untransmittable, and treatment as prevention, also known as TASP. So people living with HIV, they should take medicine to treat HIV as soon as possible. HIV medicine is, as I was talking about earlier, antiretroviral therapy, also known as ART. If taken as prescribed, HIV medicine reduces the amount of HIV in the body, also known as the viral load, to a very low level, which keeps the immune system working and prevents illness. This is called viral suppression, defined as having less than 200 copies per milliliter of blood. HIV medicine can even make the viral load so low that a test can't detect it. So if an individual gets tested for HIV, sorry, I apologize, not tested for HIV, but if an individual is having their viral load tested and they're taking their medication as prescribed and their viral load is so low that that test is not able to detect it, we say that they have an undetectable viral load. So getting and keeping an undetectable viral load is the best thing that people with HIV can do to stay healthy. Another benefit of reducing the amount of virus in the body is that it helps prevent transmission to others through sex, syringe sharing, and from mother to child, pregnancy, birth, and breastfeeding. This is sometimes referred to as what we call here treatment as prevention. So by being on medication, by getting to an undetectable viral load, this is a form as prevention. And so once again, I'm going to call on our friends here, helpstopthevirus.com, to explain more in detail about viral suppression, undetectable viral load, and treatment as prevention.
This is a special message for people who have HIV, but people who don't have HIV should hear this too. We want to tell you about something that helps lower the chance of spreading HIV dramatically. How? It's called treatment as prevention. But think of it like this: treat to prevent. There are two really important things to know. One, if you have HIV, starting and staying on treatment helps stop the damage HIV causes, so you can protect your health. Two, by staying on treatment, you can help prevent the spread of HIV. Let's start with part one, treat. There is no cure for HIV, but one important goal of treatment is being undetectable. When you have HIV, the amount of virus in your body, your viral load, goes up, and that's not good. But starting and staying on treatment can get your viral load so low it can't be measured by a test. So low it's undetectable. You still have HIV, but there's less virus in your body. With me so far? Okay, here's part two, prevent. It's like this. Taking HIV medicine every day helps you get to and stay undetectable. And that means there's less virus in your body to pass on to others. That's why we call it treat to prevent. According to the latest scientific research, it means there's basically no risk of spreading HIV through sex. That's a huge deal, but remember, HIV is still in your body. So be safe. Use condoms. Because being undetectable doesn't prevent other sexually transmitted infections. And remember, stay up to date. And talk to your healthcare provider about all the ways to prevent the spread of HIV and about anything that keeps you from taking your medicine as prescribed. That way, you can treat to prevent, to keep HIV from damaging your body so you can help protect your health. And prevent the spread of HIV so you can help protect others. And help all of us get 2 steps closer to stopping the virus.
All right, so hopefully that kind of cleared some things up there. So we have a better understanding of why it's important for people living with HIV to stay in care, to get to an undetectable viral load, because it's a form of prevention, right? All right, so National HIV Testing Day. It's every year on June 27th, and this is a day to encourage people to get tested for HIV, know their status, and get linked to care and treatment. So the theme for this year, 2021, is My Test, My Way. And basically this emphasizes that there are different ways and places to get tested for HIV, including at home with a self-test. So this is something new that has been out for a little while now, but really got a lot more support this year in light of the COVID-19 pandemic, being that people weren't necessarily able to interact with other people like they usually did. There was a lot of support to push the at-home HIV test. So now you don't even have to leave your home to be tested for HIV. You can simply order this online, it'll be sent to your house, and you can take the test right there and find out what your results are. So if you're interested in learning more about how to obtain one of these at-home tests, please visit the CDC or the Center for Disease and Control website, and I have it posted here. And you'll find resources on there, and they actually list the states, and you click on the state that you live in, and it'll show you what resources are available to you. In addition, it'll also show you resources if you would prefer getting tested in person at a center. That's also an option as well. But once again, I just want to encourage that June 27th is National HIV Testing Day. Please, if you haven't been tested this year, or if you know of someone that you think would benefit from getting tested, find out, in your local community who's doing an event for National HIV Testing Day, or who's providing HIV testing. And a lot of times, like I said, you can find HIV testing for free. You just got to do a little work. Most places will provide them for free, but yeah, just keep that in mind. And then these are just some additional resources. Of course, the Centers for Disease Control and Prevention is a really good one. If you need more updated information, or if you want the most updated information about HIV in terms of statistics, understanding who's at risk, knowing where to get tested, knowing where to be linked into care, or just wanting to have a better round knowledge about HIV and AIDS, please visit that website. If you would like to find a place that is providing HIV testing, please feel free to look at this website here at hiv.gov. This will also help you locate in your area where you can be tested. And then for Gilead HIV/AIDS medication, if you need assistance with affording, whether it's your HIV medication for people with a HIV positive diagnosis, or if you're trying to afford what they refer to as pre-exposure prophylaxis or post-exposure prophylaxis. These are 2 HIV medications for people who don't have HIV that can be used as a prevention measure. Feel free to look on this website, and it'll have more information for you. Gilead does a really good job of lowering the cost, sometimes to no cost, and accessing these medications. And so this is the end of the presentation. I thank you for joining me today. I hope that you were able to learn something. I hope that the information was valuable, and I look forward to seeing you again in the future. Thank you.